This segment of Delmarva Life is brought to you by Peninsula Home Care.
I'm sure you'll probably agree, healthcare is constantly changing, from new discoveries that pave the way to recovery to technology that's making treatment options less invasive and more successful. Keeping track of these changes can be a full-time job.
But perhaps some of the biggest changes have come to where healthcare is administered. It used to be if you were sick, you went to the hospital for a few days for treatment. Well, today the focus has shifted to keeping the patient in their own home.
Home care is one of the most rapidly changing forms of health care.
And for good reason. Robyn Coughenour of Peninsula Home Care says when it comes to keeping people out of the hospital, home care leads the charge.
The main goal, one of the biggest goals of home care, is to prevent rehospitalization or hospitalization.
A focus that has certainly shifted over the years.
Home care originally started out in the local county health departments, and the nurses there would go around and everyone had a little white card and their little uniform and kind of go house to house, and it was very much checking on patients and not a whole lot of skilled care going on, but still a big service to the community.
Eventually, the home care responsibility was given to the hospital. It was 30 years ago Peninsula Home Care became a department within Peninsula Regional Medical Center. Then, in the early 2000s, PHC left PRMC.
Once it left the hospital, it had the opportunity to grow and expand and cover a lot more counties.
And the staff has expanded their level of expertise as well. Robyn says that's because patients are coming home sicker.
We hire nurses that have good, solid acute care experience. You have to have been in the hospital seeing these kind of new treatments and these new things that are going on to be able to do that in the home. One of the advantages you have in the hospital that you don't have at home is you can't just kind of stick your head out the door and say, hey, I need some help. You're out there. You have to really have a high level of skill to make good judgments and to make sure that you're making the right decisions for patients.
Decisions about treatments that used to be administered in the hospital. Even monitoring patients is easier with telehealth.
Telehealth has made a huge impact in that we are able to actually monitor people without having to physically be in their home. So the patient goes on, hooks up to their monitor. Those readings are transmitted in, and we can actually see if a patient's getting in trouble a lot sooner.
And that's not the only high-tech equipment patients are sent home with. This eSTEM device, as demonstrated on Delmarva Life by Jimmy Hoppa, is used following surgery to help with pain relief. And the Sabo device, also featured on Delmarva Life, is designed to reprogram the brain following a stroke or injury.
We have specialty programs for diabetes, COPD, people that have breathing problems. We have wound care, many different kind of wound care initiatives and programs and different technologies that we use in the home. IV therapies, all kinds of IV therapies, not just antibiotics, but also feedings, people that get IV feedings at home and all those things.
If there's ever any question as to why home care is important, Robyn says the answer can be found in patient outcomes.
And as soon as they get there in their own recliner with their own family members around and their four-legged companions and all those kind of things, just those comforts of home and feeling like, okay, I'm home, and getting some control back. When you're a patient in the hospital, you're told when you can sleep, when you can eat, okay, time to get up now, time, and so having some control and feeling like you're taking control of your life and your own health care, working together with your home care nurse more as a partner. We really want to make sure that our plans of care and the things we do for patients are that we're working together as a team.
And if the day comes that a patient is unable to maintain their health at home, home care can help plan for the next step.
So if we're in the home and we see that we're not able to meet their needs, or their needs are getting a lot greater, they can't stay home alone, it's not safe, we can go ahead and move them, transition them through that next level of care.
Until that time, Robyn says home care will continue to provide what people need to live their lives where they want, surrounded by whom they want.
The future for home care is just limitless. I think that we are able to provide such a high level of care in the home, quality care, and care that is a lot less expensive than some of the other kinds of levels of care. So I think that we'll see, as things change and things move away from more institutional settings, that home care is going to be expanding and even having more and more programs, more and more liberties to do some things at home that we are not able to do now.
And Peninsula Home Care is celebrating 30 years of service to Delmarva. That service is made possible with strong partnerships with area hospitals such as PRMC and Nanny Coke Memorial. And to learn more about the partnerships or Peninsula Home Care, go to our website, WBOT.com. Click on our picture at the top of the page.
It's important to plan ahead. Now, once you reach and eventually pass retirement age, where will you stand financially? After the break, we're going to talk savings, how you can build a substantial rainy day fund in just a few simple steps.
And more about money. Who's writing your paychecks? Have you always wanted to be your own boss? Well, next we hear the story of one local man whose dream came true with the help of some local money experts.
And a little bit later on, we're in the Delmarva Life kitchen with a talented local chef making a delicious crab meat pizza. And we're not going to let him leave without dessert. We're also making cheesecake. Delmarva Life. We'll be right back.